Thank you. Good evening, everyone. Thank you for joining us tonight for Med School 101. Let us start by introducing ourselves. I am Tara.
And I'm Niran, and we will be your MCs for tonight. We hope that you will enjoy and learn more about medical school from this event today.
Joining us today will be our own guest speaker, Mr. Robert Saw Jr., who is a fourth-year medical student at our very own Taylor's University, as well as the first president of the Taylor's University Surgical Society. He'll be sharing with us all his first-hand experience and advice about preparations for getting into medical schools in Malaysia, and a glimpse into the school life of a med student as well.
I'm sure that this sharing session will be useful for everyone here tonight, so listen and learn. We will start off the event tonight with a talk by Mr. Robert, followed by a Q&A session at the end for everyone to clarify any doubts you may have. Please feel free to type your questions in the Slido link provided in the chat box. Kindly refrain from typing your questions in the Zoom chat box.
Before we begin, make sure to read all the housekeeping rules posted in the chat box, and please abide by the rules, or else we will not hesitate to remove you from the meeting. All right, without further ado, I'll pass the time to Mr. Robert to start off with his session. Mr. Robert, please.
Hi, okay, thanks Tara, thanks Niran, hi. Just give me a minute, yeah? Okay, can you all see my screen?
Yep.
All right, okay. So first off, I'd like to thank TLPMC for this. It's an honor to give a talk here right now on this topic to guide pre-medical students into medical schools here in Malaysia. It's one topic that is very dear to me. It's okay lah. Just we don't make it as sort of like a very official webinar, very serious webinar. It's more of a chit chat session. What I have to say about getting into medical schools here, especially in Malaysia. Now, before I begin, just want to introduce myself. You know, some of you might think, "Ayo, who is this fellow? Why should we listen to him?" Right? So, my name is Robert. I'm a Robert Saw Jr. You can call me Robert. I'm a fourth-year medical student here in Taylor's University, and I'm a full scholar in the institution throughout the entire duration of my studies in Taylor's University. But before that, I was a Cambridge A-levels student in Inti Subang. I graduated valedictorian with 3 A stars, and I was accepted in local Malaysia universities and also abroad. But just in terms of local universities, I was accepted into Taylor's, IMU, as well as public universities like UM and 𝐿𝐿. Okay, those two lah, no need lah. Okay, so just sit back, relax, have your dinner, have your meal, have a drink. Just listen to what I have to say. We'll have it sort of like a chit-chat session. Okay, so going into medical schools here in Malaysia, I think most of you would know, despite Malaysia being very, very small relative to other countries nearby, we have a lot of medical schools here in Malaysia, private and public. Okay, and okay, so with private and public, we sort of have a few big universities. The first one being private. Here in the Selangor area itself, you have Monash, Taylor's, IMU, MSU, MASA, SEGI, and a lot more. Trust me, a lot more. Okay, I don't have I just want to introduce you all to some of the medical schools, your options here in private. At this point now, I just want to advise you all. If you are all planning to go into private, some privates, they do have an entrance exams you need to take, some they don't. They just require interviews. Certain universities, they have entrance exam, BMAT, biomedical assessment test, or some like Monash, they have an aptitude test. The aptitude tests, results of which they will determine whether or not you be accepted into the institution or not. Okay, so that's something you need to look out for in the private sector. As for the public sector, you have the National University of Malaysia, 𝐿𝐿, USM, UPM, UNIMAS, and a lot more actually. Yeah, and a lot more actually. I know most of you, I'm not sure how are the cohorts, who is the cohort in here right now, but I'm guessing most of you are in the private sector, and a lot of you by now would be sort of, I would like to say the word tainted, okay, with sort of rumors saying that once you're out of the public sector, you're in the private sector, you cannot go back to the public sector. Truth is, you can. Okay, I've done it, and we will talk about it later on. Okay, but if you are in the private sector right now for A-levels, SACE, or whatever, you can go back to the public sector. Mainly University Malaya, they do accept. So don't fret, don't stress. You can still go back to the public sector. Okay, so this is just for an introduction. Now, the question is, you have a lot of private unis, you have a lot of public unis. The question now is, how do I choose? Which do I choose? And what sort of things should I consider when making my decisions, right? Don't worry, we will try to dissect down certain factors that should be important, okay, for you to discuss with yourself or with your parents or whatever. So the first one being location here in Malaysia. Now, I know some of y'all still probably at the age of 17, 18, you still want to be with your parents, but later on, once you start medical school, you'll be a bit older, you might want to be away from your family. Okay, that's what I was also lah. But some of y'all want to stay closer to your family. Now, some of you might be in Penang, some of you might be in Johor. You want to be closer, so you can choose some medical schools closer to your parents' place now. So if it's Penang, you have like choices like Penang Medical College. Now they call it the RUMC. Or if it's in Johor, you have Newcastle. Okay, or if you want in Selangor, also got a lot, IMU, Taylor's, Monash. So location is very important. Now, why I say location is important is because 5 years in medical school is very, very stressful. Trust me. You see my 2 designer bags here under my eyes, eye bags. This one is very stressful. You need a good support system. And I always tell my juniors and all, your best support system is your family. If for some of us unfortunate enough to not have that sort of support system in family, then the second closest thing we can rely on is our friends now. Okay, so location is very important. At the end of a stressful day, all you want to do is just be with your family and just spend some time with them. You know, stress relief is very important. Okay, that's location in Malaysia. Second one is tuition fees. Now, tuition fees is very drastic when you compare from public to private universities. Private universities, it ranges about, cheapest you can get 300,000 to 500,000. It can go up to 600,000 also, depending which year you enter. And also, if you go to public, I can't say for other universities, but when I was accepted to my fees was 15,000 for 5 years. So it's 3,000 per year, ringgit Malaysia per year. So you can see the difference is very, very drastic. So if you are fortunate enough to be able to choose between private and public, I would say my advice would try to lessen your family's burden. Okay, because it's all it doesn't matter which uni you come from, whether you're from 500,000 school or 15,000 school. At the end of the day, the doctors, they won't address the patients, they won't address you as Dr. 500,000 or Dr. 15,000. No, you're still a doctor. Okay, so if you can go for cheaper, go for cheaper. But if you can afford already, then by all means go ahead. Then you choose private sector lah. Okay, so that's tuition fees is very important. And then because it's expensive, don't think that we only can rely on our own money or PTPTN or whatnot. Don't worry, we will talk about scholarships later on. Next one is surrounding environment. Now, different schools, they can offer different sort of things. First, the main one is environment, where they are located, right? So if you like the hustle and bustle of cities, certain universities, they can provide you that, just that. They are located in the city area, you like the busy life, you like the rush and all the stress and all that, you can go for that lah. Okay, some of them, they are all the way in the district areas. It's very calm, it's very laid back life. So if it's something that you want to pursue or you want to experience yourself, by all means, go ahead. So at this point, I'd like to advise you all, please, if can, go and visit your prospective universities. See how is it like, how's the city. Don't just see the school, see about the surrounding area. Is it a good place? Is it like what sort of place they are located in lah? Okay, it'll make a difference, trust me, because all medical schools, trust me, all medical schools very stressful, but if you're in like a city area where there's a lot of entertainment to some people, it's important, like bowling, karaoke, then you can go and de-stress yourself. Or if you find that the way to de-stress yourself is being in an environment where it's very laid back, then obviously your choice would be different lah. Okay, so that's something you need to think about surrounding environment. Next one is class cohort sizes. Now this one was my personal deal breaker when it came to choosing my medical school. Some medical schools, they can reach up to 150 students per cohort or per batch or per class, right? So 150 students, and with that 150 students, you obviously can't make friends or have a special bond with your lecturers, and and especially your friends also, like you sort of like know everybody here and there superficially, but never like make strong bonds with them. So that's why I chose Taylor's. Here in Taylor's, we have about 30 students only per class. So with that, we could make we're very close. We're very close to our lecturers, and also we're very close knit to all our classmates. I'll show you pictures. Those are testaments to our close-knitness lah, I would say. But don't worry, because sometimes if you start out your preclinical year, I mean your first 2 years, having 150 students, doesn't mean all 150 will follow you all the way to clinical, right? So some schools, they have twinning program where half of the cohort, or maybe let's say a third of the cohort, will be sent to abroad for their clinical practice. Okay, so then the class size will downsize a bit. It will become smaller. So if it's something that you feel that if you feel will affect your studies, then it's something that you need to consider lah, about the class cohort size. Okay, but last one I want to emphasize is it's what you want, because at the end of the day, it's not your friends, it's not your parents, it's not your auntie, uncle who are sitting going through medical school. It's you who are sitting medical school. So if you feel or if you resonate with the school, then it'll be good for you lah. It'll be smooth sailing, not smooth sailing, but less bumpy. Okay, you'll be less frustrated with the school. All I can say is I had a lot of choices, but I made my decision ultimately when I visited the schools. Okay, when I was in Taylor's, I felt this is the place where I should be, and it's a place where I can see myself studying and growing and learning to become a doctor. Okay, so that's for now, I can say it's what you want lah. If you don't have pressure from your parents saying, no, you have to go to this certain school, no, you have to be this certain, certain course, then yeah, I can't say much lah. But if you don't have that sort of pressure, then think about what you want. Okay, Now let's talk about scholarships a bit. I know the minute I say scholarship, a lot of you perked up. Okay, so now scholarships, who doesn't want scholarship, right? Typical Malaysians. If we want it free also. So my advice now is don't wait until you finish your pre-U courses to only be looking out for scholarship, to only then be looking out for scholarship. Start looking out for scholarships right now because, okay, I think I'm being recorded, but you know what? Screw it. I'm just gonna say it. Scholarship season is the best when the country's economy isn't doing too well. Okay, reason because when an institution gives out scholarship, they get to reduce their tax every year, their tax payment every year. So now I ask you all answer truthfully behind your own mics lah. Is the economy doing well? Okay, so if it's doing not well, then now is the time to look out for scholarships. A lot, actually, there are a lot. You don't have to only look out for university institutional scholarships. You can also look out for company, and you can also look out for private sponsors. I've met some private sponsors. They are willing to sponsor your medical education here in Malaysia. It all depends on your PR, who you know, and whether they're willing to help or not. Okay, so the first question, you need to know which university and which company or which person or private sponsor. Next question, if you find a scholarship, you always need to ask, is there bond to the scholarship? It means after conferment of your degree or after graduating, do you have to work for the university, or do you have to work for that certain hospital, or do you have to pay back the university in other forms of payment, not monetary payment, but maybe teaching or maybe some social work? I don't know. There are a lot out there, so you need to read the fine prints. Don't forget. Okay. Another thing to look out for is to note is the criteria, whether they need academic or co-academic criteria. Now, academic, of course, I think it's all scholarship. They will look at academics, but some they prioritize more of co-academics. So if it's a sports scholarship, then most probably they will look at co-academic. Then you'll need to be in a national level sports person, I would say lah. Okay, if it's purely academic, then your CV is very important. Another thing I need you all in capital letter, I wrote that deadline. Okay, this is my personal lesson, a very expensive lesson. You need to know the deadline. Remember all your deadlines, okay? Don't miss it. And ask whether if there's any interviews done. Some scholarships, they will require you to present yourself, try to sell yourself to them, to a board of scholarship, to the scholarship board, why you deserve the scholarship. Some they require interview, one-to-one interview, or maybe with the scholarship board, or some they even have aptitude tests. Okay, they say they don't want to have bias, so they will grade you, they will stratify you according to who you are on paper. Okay, so if they say they are looking for someone with leadership quality or something, then the program will rank you all based on leadership. Then from there, they will choose top 1, top 2, top 3, something like that. Okay, so always ask. Don't think that it's a bad thing to ask the format of how will the participants be chosen. Actually, it's they will respect you more if you ask them blatantly lah. You just ask, how are the students being chosen? Okay, and the last question is typical Malaysian questions: need to pay back one or not? Okay, some universities, they only take a portion of it, so it's up to them. They say 20% you have to pay back, 50% you have to pay back, or some universities they say don't need to pay back at all. Okay, then you make your decisions from there lah. And then also, I just want to add on here, I just remembered, for some of you who are continuing here in Malaysia, you are taking up PTPTN. Now, PTPTN is sort of a loan where after you graduate, after the conferment of your degree, you can slowly pay back the government or pay back the institution, but with an interest lah. But if you do really, really well in medical school, I've heard a lot actually, of seniors who've graduated where their PTPTN was converted into scholarships. So they eventually didn't have to pay back a single cent because they did really, really well. So so scholarship doesn't just come in the form of outright scholarship like that. It can come from PTPTN alone, and then convertible. They call it convertible loans. Okay, and then my tip right here, right now, is whether you hit or not the criteria, you just apply for all. Mana tahu you dapat. Okay, I've heard of stories where they don't even meet the criteria, but somehow they got it. Okay, it's based on their the way they interview is they had to sell themselves, and they were really, really good talkers. So it's yeah, it really depends lah. But again, if you hit the criteria or not, just apply for all. Okay, then we talk about entrance interviews. This is one very scary part when thinking about medical schools. Trust me, it's in the moment you will feel like, ayo, I'm not gonna do well for the interviews and all, but actually whatever you answer and all, it doesn't matter. They just want to see who you are as a person and how well you react to questions being thrown to you in the moment, right? So now we'll talk about interview formats. Now, different universities, they have different formats to assess their sort of students, okay? But my tip right now here is jangan kanjong, okay? Always stay cool and stay calm. Whatever format they throw your way or whatever format they change on the day itself, don't panic, okay? Okay, so the first format is 1v1. Either 1v1 or 1v2, or maybe 1 versus the interviewers. Okay, this one is a very classical or very sort of traditional entrance interview, where one will be the sort of like the clerk to note down or to take down notes, and one will be the active person to ask questions, and then one will be with the student who have to answer questions and things like that lah. Okay, so this format is not really complicated, so you just have to attend, say, oh, I'm here for my interview, and then and most of them, most of the interviewers, they tend to be the lecturers in the faculty themselves. They are not from the admins, or they are mostly lecturers lah. So their questions can turn medical related things. We will talk about the questions later on. My tip here right now is dress formal, and even if you have no confidence at all in the moment, I like this sentence so much: fake it till you make it. Okay, now this one it gets quite confusing a bit. This is called the MMI method, multiple mini interviews. This was the method I had in UM and 𝐿𝐴𝐾𝐝. So each station, you get to you sort of rotate yourself in different stations. So in station 1, each station you'll spend about 5-10 minutes depending on the universities. So in each station there'll be one lecturer, okay, and one guide or one sort of prompting question. The minute you start the station, they will ring the bell. You are allowed to read the question and answer the question, and then after the time is up, they will ring the bell and you will have to go to the next station. Okay, then so on and so forth until you finish all the stations. It's very exhausting, and it's very you have so much adrenaline rush. By the end of it, you feel like you've run half a marathon. Trust me, it's so exhausting. Okay, now the questions in each station, they can change it. They can be non-medical related, they can be medical related, or they can be even questions about what are your thoughts on this and that. Okay, so this is the second method of interviewing, MMI. Very notorious, but if you do get it, it's an experience I think you'll never forget. Okay, let's talk about interview questions. Now, typical entry questions is why medicine and why not any other courses. Some questions, some of the famous other courses that they would always say is why not nursing, why not pharmacy, why not biomedical, okay? And then another question is, what are your strengths and weaknesses? How do you deal with stress? And who are your biggest inspirations? So these are your bread and butter before entering medical school. So my suggestion is, my advice is, take these questions, find out the answers to these questions. Okay, have them all typed out, sort of memorize your answers. So by the time you go into interviews, you are confident enough in your answers, and you can just sort of vomit them out back. Okay, you won't waste another minute about what no. Okay, you look a lot professional. Some universities, however, they ask you some GG or atas questions. Atas questions means questions to sort of throw you off your game. Okay, so that they want to see how you react and how well you work under stress. Okay. Some of the questions that were asked to me was, what do you know about the Hippocrates Oath? Now, Hippocrates Oath is a very important oath, especially in the medical field, the contents of which you need to know. Okay, just know summary. What does it mean? When do you take the oath? And who is the oath for? Okay, another one was of all the organs in the body, which do you find interesting and what is its function? This one is very subjective, okay? Like I would say the organ is this and another person would say this, but they would just want to see how you justify it. Why? They want to see how your train of thoughts and why you think so. They don't really care about your answer. They don't really care if like you like the finger more than the heart or something. They don't care. As long as you're able to justify, they're quite happy. Okay, some of the institutions, they like to ask about common diseases here in Malaysia that we know of. Okay, my advice would be to read up on polio and also COVID-19. Anything, and also now monkeypox. Okay, they tend to ask about current situations here in Malaysia or in around the world. What do you know of? All they want to assess is whether you are up to date with current situations and whether you read or not. Okay, and then what are your opinions on the current Malaysian healthcare system? I'm not gonna lie, I sort of stumbled with this question. It took me a while to gather my thoughts, but yeah, I won't say what my answer is, but you know, just try to figure out your answer for the current Malaysian healthcare system. And some case-based questions also, they ask some scenario-based. It's more of okay, in a train track, one track has one person tied to it, and another train track had another 5-person tied to it, and there's an oncoming train in which you are given the chance to change the track of the train, whether it'll hit the 1% or the 5%. Which do you choose? Sort of something like that lah. Okay, so it's always I don't know how you are taught, but my philosophy is always the least souls or the least person involved. Okay, there's no right or wrong answer. They just, again, they want to know how you think and your train of thoughts and to sort of justify yourself. And some MMI questions like remember the MMI, the multiple mini interview. So in 5 minutes you are given a scenario. Let's say town A and town B, they're very close to each other. Okay, and then suddenly there's a flood, and town A had to evacuate and go to town B. So what are sort of diseases that you see arising within town B people? Okay, now these are not really atas questions. These are answers can be found within your syllabus itself, especially the Cambridge A-levels syllabus. So you've heard about cholera, you've heard about TB, okay, because of overcrowding and because of water contamination. These are the sort of diseases that can come about lah. Okay, they won't ask you treatment, they won't ask you signs and symptoms and all. They won't. Okay, they're not that there's time also lah. So those are the sort of questions you can expect in your interviews. And my tip right here is to keep your answers short and sweet. I'm very talkative, so I always have to remind myself, keep my answers short and sweet. Sometimes if they hear too long also, right, the lecturers also, yeah, what is this guy? Does he know or not his answers, you know? So keep it short and sweet. Okay, so I just want to, I think a lot of you all, I don't know if you all are still paying attention or asleep already, but I just want to show you all some studies and co-academics as a medical student, a day in my life. We take a break a bit, we go through what is expected of you as a medical student, then we will continue on with our medical school 101 serious section. Now it's just the chill part a bit. Okay, just for introduction, your medical school will be divided into preclinical years and clinical years. So the first 2 years will be preclinical, and the last 3 years will be in clinical. Now this is in the Malaysian system, the Malaysian structure. If you go to UK, it'll be 6 years. You have to find out yourself lah. Okay, so in the first 2 years, it'll all be textbook really very textbook oriented. You have to memorize the textbooks, you have to memorize facts, and you have to vomit back out all the facts you can during exams. And you'll be tested on a few subjects. You will have anatomy, physiology, biochemistry, pharmacology, medical ethics, research. Okay, and then once you pass your barring exam in end of year 2, you will go to clinical years. This is where you go for your hospital attachments and all. So if you're in hospital already, this will be very patient-centric. You'll learn a lot from the patients, and you'll be tested on very clinical rotations such as internal medicine, surgery, OB-GYN is obstetrics and gynecology, all the pregnant ladies and all, and also orthopedics, pediatrics, ophthalmology is the eyes, ENT is ears, nose, and throat, family medicine, radiology, and emergency medicine. Okay, I don't think you all could catch that, but if you do, good, I'll send you a certificate later. But just day in my life, so this was in my preclinical years, so we did a lot of tissue studies. Okay, so anatomy is looking at the structure of the human organs itself. So this is a lymph node. I don't know if you know, I think you all know what a lymph node is, right? So we take cross sections of it, and this is what it looked like normally. So anatomy is the normal structure of an organ. Now, pathology is what happens to the organ when it is diseased, okay? So this is the exact same lymph node, but it's undergone a diseased state called lymphoma, okay? It's a sort of a cancer, okay? So this is the pathology, abnormal, when it's in an abnormal state. And this was my research project. My good old worm babies. I had to stay up in the lab until 3 o'clock, 5 o'clock just to harvest them, just to make sure they're okay and lay. All these are their eggs that we need to sort of fish out. Okay, so this was my preclinical lives. And then we are also given here in Taylor's, we are given exposure to venipuncture, sort of very clinical procedures, so that once we move on to the clinical years, we are not, we don't have culture shock. Okay, we are trained already. So we did venipuncture. We also have blood banks, trips to the blood bank. This is my good friend Esther Sim. And then also we have this. We have a lot of mannequins where they can, the lecturers, they can change the heart murmurs. And if you know what murmur is, no, if you don't know what murmur is just the abnormal sound a heart makes, okay, because of the valves, abnormalities in the valves. So they can change the murmur sound, and we have to listen, and we will have to tell the lecturer what we hear and what sort of murmur it is or what sort of abnormality the heart has. This is our wet lab anatomy, cadaveric lab, where we dissect the body and look at the anatomy within, or the organs within the human body itself. So this is my lecturer, Dr. 𝐿𝐿, and these are our classmates. Okay. Yeah, so this is the small cohort classes that I was telling you about. These are all my classmates, all 30 of us. We like to dress up, especially during festive seasons. Okay. All right. So we also have because we're all small classes, so we're very close knit. Not only among our classmates, but even between batches also. So very close knit senior junior batches. So this is Prof Wong, our microbiology professor. This was during a competition. It was in 𝐌𝐞𝐝. So we are sent to go out for competitions, also fight with other universities, see who's the best lah. Okay, and then we also have hospital visits. We have sports day. Sports day, I don't do much lah. I just there be cheerleader only. Okay, and this is exam materials. I don't want to make it all too rainbow and sunshine, but this is just for one paper. You have 3 thick books to memorize and study. I don't want, yeah. Okay, so just keep that at the back of the mind. It's all stress also. Yeah, and then when we go to clinicals, it's all about learning from patients. So you have to clerk the patient. You have your history taking is just asking the patients what happened to them, and then we try to we become the investigators, try to see what sort of problems they have, and then how best we can treat them. These are all my besties. These are all my juniors. Now they turn to my besties already. Again, the small cohort sizes. This is my Dr. 𝐿𝐿, who is my obstetrics lecturer. She's a pro in pregnancy. Okay, and this is just me on a daily basis. Again, my 2 designer eye bags. Okay, that's what I look day to day lah. Then also see certain hospitals you are attached to. Sometimes you get posted to district areas. Sometimes you get posted to hospitals in the city like 𝐻𝐾𝐿, PPUM, but we're not lah. So we are sent to Hospital Bentong, and now we are being sent to Banting. And fortunate enough, Hospital Sungai Buloh is being opened up to us again. So it's very near, and it's very more atas lah. It's all computerized and very modern. Okay, you have choice. You have chance to also involve yourself in extra or co-curricular activities. For me, I like to do suture. Okay, this is me in action, triaging a patient. Triaging is just basically taking their blood pressure, their blood sugar profile, blood sugar, and then just to see how urgent they need to see a doctor lah. Okay, and this one latest one, we're always on our feet. We're always in ward rounds. Ward rounds is just to go bed to bed and learn from the patients themselves, and we discuss about the case and how we can treat the patients. We're mostly on our feet, minimum 3 hours, sometimes 4 hours. Okay, but again, I love surgery, and this was my latest one, making the first abdominal cut surgery workshop. This is me. She's already graduated. This is Janice, Dr. Janice. She was the one who taught me how to do suture last time, surgery. And this is my president in MSSS, Wendy. Okay, again, I said clinical years, we're very patient-centric, so we learn a lot from the patient. This is a patient's abdomen. We have to listen for the fetal heart, and then also a suturing workshop, my bread and butter, not my bread and butter, but my hobby. Okay, this is a recent one. The LAB workshop, the laparoscopy advanced and basic workshop. Now I know some of you would recognize some friendly faces here. These are all the TLPMC leaders. Okay, and these are some of my excos in the surgical society. So that's all about the day in the life of a medical student. Okay, now we go back to our serious talk. How you can prepare for medical school as pre-university student. Now, a lot of you might think, medical school is later on, is in a few years' time, so it's a problem for another day. No, actually, you can start your preparation now, and my advice is to start now. Okay, if you haven't done so, you can start now. Now, the first thing I want to emphasize on is the importance of your curricular vitae. Doesn't matter you want to continue here in Malaysia or you want to continue abroad. Your curricular vitae is very important. Arrange them from most recent to oldest. Your I've seen a lot of curricular vitae, they put the oldest one since kindergarten at the top of the list. What's the point, right? The recent one first, followed by the latest one. Okay, and don't put pictures. There are a lot of guides out there to how to construct your curricular vitae. You can reference them. Next one is now is a good time. This one not now lah, but if you have the chance, please make friends with all your lecturers, your A-levels lecturers, and all, so that by the end of the term you can sort of ask them, oh, doctor, actually, whoever lah, actually I'm planning to go for interviews for medical school and all. I think it'll be good for me to have a reference letter. Then they'll be more compliant to write you a reference letter. Okay, so this one is in the long run. So reference letter is basically just to talk good about who you are and what have you done and who are you as a person. Okay, now and also to answer the interview questions. I'll send the slides to TLPMC and they will then forward all these slides to all of you. So you can have a look back at all the interview questions and find out the answers to those questions. Okay, ask around what else other questions that may be asked. So you can prepare yourself for the interviews and you can ace your interviews. Okay, another thing for you to do is now scout for unis. If you have time, weekends, pay a visit to the schools. Some schools, they have an open concept, so you can go anywhere, you can go anytime, visit the school and see the environment, walk the halls, see whether the school is for you or not. Okay, another thing is to read up again on the current events here in Malaysia and around the world, especially medical conditions or diseases that you memang have to read. There's no shortcut. Okay, so those are the preparations. Okay, now this one is just a reference letter. It doesn't have to be so long. It can be 1 page only. This was my reference letter back when I was in A-levels. And then this one is a method that I think would be very, very useful when you tabulate the unis and and all the courses that you plan to apply for. In each column, you can put in different facts about the course itself. So you can tabulate and you can see, oh, I need these results to enter for this uni. I need this result. I need this sort of entry requirement to enter this uni. And is there scholarship for this university itself? Don't think the facts in this table are all true for 2018, 2017. Okay, so now you have to make up your own table and then from there you proceed on lah. Okay, so this is just the tabulation of unis. During the Q&A session, we will talk more about this in the Q&A session. So please ask questions if you have any burning questions, like you just ask. I can tell you more about it. And then, yeah, so before we end, I just have one advice and one request. Okay, I have a lot of advice during this evening, but this one is just don't underestimate the power of small steps and consistency. Now, if you want to go really far, don't go too hard on yourself. Don't be too kiasu. Take every day and just go through day by day. Take small steps, okay? And you'll see yourself achieving your goals very, very soon. But if you tend to do things very, very grand and in a very short amount of time, you are going to burn out. You are going to the effects are not going to be nice lah. Okay, now this one I wish I had learned earlier in life, but I'm glad I did lah now. This is one of my favorite advice when I talk to juniors and all. Okay, so in terms of college wise, you thinking about past years, about Cambridge A levels, paper 1, paper 2, paper 3, paper 4, paper 5, you're thinking, oh yeah, I have AS, A2, and you'll think of all the different papers you have to sit for, and you have to start doing your past years. Don't, it's okay. You can start with your topical first. You do a bit, make sure you understand what are the keywords that they will mark you on, and then from there you start building yourself. Then only later on you time yourself, especially, oh my god, chemistry paper 1, 30 questions. I always have a small timer with me. Okay, so those do things small, take small steps and make sure you're consistent. That's the first advice. Yeah, and then another last thing, my request is that if some of you who already get into medical school later in your life, congratulations. And then once you've graduated, again, congratulations. I just hope you see that Malaysia needs you all. Okay, Malaysia, a lot of people are fleeing the country, and with them, they take their skills, they take their knowledge, and they take their talents with them. And very kasihan, I see, because Malaysia really, really needs us. It's not just the patients who will need you, but the fellow doctors also will need you. Okay, the number of doctors here in Malaysia will start to dwindle down, and because the numbers start to dwindle down, we don't efficiently and effectively treat our patients. Okay, and if any of you do become doctors, please come over here. Okay, here, Sabah, I will be here. I'll be treating patients all the way here in Sabah. Okay, but Malaysia really needs you, because after all, Malaysia is tanah tumpahnya darahku. And with that, I end my session.
Thank you, Mr. Robert, for this informative presentation. I hope this sharing session has provided everyone with some useful information. I found it really interesting to hear about the types of interviews, and I found his personal tips very helpful as well. Let us now take a group picture with Mr. Robert before we move on to the Q&A section. Everyone, please turn on your cameras and give us your biggest smiles.
Turn on your cameras, guys. Okay, I'll take the picture and okay, I count to 3, okay? Okay, 3, 2, 1. 3, 2, 1. Okay. Okay, so now we're going to move on to our Q&A session. Everyone, the Slido link will be sent in the chat box, and you guys can type all your questions there.
Okay, so our first question is, What are the medical courses I need to attend in order to become a surgeon?
Okay, so surgery, you first and foremost, you need to become a doctor before you become a surgeon. So all surgeons, they will have to go through 5 years of medical school. Then they will have to do their 2 years of housemanship, 2 years of MO-ship, medical officership, before they get to pursue masters in surgery. So to answer the question, you will need 5 years of medical school and then another 4 years of masters in surgery. And in between, you need to service the citizens for 4 years. Okay.
All right, next. Someone asked, is medical school in Malaysia better or overseas better? Oh, wait, there's a technical error.
That's okay. Right. So which one is better, Malaysian medical school or overseas medical school?
Yeah.
Personally, I say they both don't matter. It doesn't matter. But it matters in terms of where you are going to practice in the future. So if you really say, if you have with 100% certainty, you say, I want to work in the UK, okay? Then your training should be best in the UK. Your medical school, the best medical school for you would be in the UK, because there they will train about Western diseases more than tropical medicine. Okay, compared here, Malaysia, we talk a lot about tropical medicine, tropical diseases. So if you want to work here in Malaysia or in anywhere in the tropical areas, then medical school around the area would be good. Okay.
Okay.
Okay, the next question. Can you give a few examples of companies or government that I should look out for that is good for scholarships?
Okay. Now, companies, okay. Are we still recorded? Okay. Okay. I'll speak for myself because I'm Sabahan, right? So if you are a Sabahan like myself, there's this fund from the Sabahan state government where they will, if you are qualified, they will send you, they will fund your medical studies in any university. Okay, so those are some of the, I can't really name them all out loud right now, but yeah, so you can sort of think about state funding, or if some companies, you obviously don't go to I think some bank companies, they do, can't remember which one, but recently they did open up, but you can just go for like scholarship.com or something like that, and then you can just narrow down your options into medicine and into companies for government. It's very easy to find. Okay.
All right. Next question. What is your best tip for getting scholarships?
Oh, very easy. Again, whether you hit the criteria or not, just hantam and send your application. Trust me. Just send in also. Just send in. And also, if you don't, I always say that when you go for interviews and all, right, don't be scared. Don't be intimidated. Okay. Instead, when you go for the interview, and if it's a cohort interview especially, you intimidate the others. Trust me, it will work. You psych them out. I'm very vicious like that, okay? But that's my strategy. I always psych people out. But my best tip for getting scholarship, again, whether you hit the criteria or not, just send in your application. You never know what you get.
Our next question is, how do you manage your work-life balance, having so much on your plate as a med student while managing clubs at the same time?
Okay, this one I really don't know, to be honest. I'm just like, how to say a work-life balance. I think in the moment when you have to do things, when you're expected to be professional and when you're expected to finish some assignments, you do it as much, you give it your all, you give it your 100%, so that when there's some time to play, you can actually go out and play. Okay, as much I really don't know how I manage, like, to be honest. Probably because I'm a Libra. Okay, my star sign is a scale. It's all about balance. Maybe that helped. I don't know. If you want to change your star sign, come to Libra. Come become a Libra.
All right, great. Next question. What are you planning to specialize in the future and why?
Planning to so I plan to specialize either in vascular surgery or cardiothoracic surgery. Why? Because I think I don't see myself doing any other things. There are a lot of disciplines out there. There's a lot of internal medicine. There's pediatrics. I love kids. I love kids so much. I have to say that because my lecturer, Dr. Lim, is in. She's a pediatric oncologist here. I love pediatrics so much with all my heart. But surgery, nothing can beat surgery lah. I think it's just passion and skills also. I think my hands are quite steady, so I think it'll be good for me to pursue surgery.
Okay, next question. What are the advantages and disadvantages of studying medicine in Taylor?
Advantages, I would say, again, small size class cohort size, so you get to know your peers well. In a way, it can be good or it can be really bad. If it's good in a sense that you can become besties and BFFs with everybody, but if you're too close, you know too much about a person, you can sort of fight with them. Okay, so disadvantage, I don't think there's any disadvantage, but I do have to say that the facilities in Taylor's are it's adequate. In fact, it's too much. Okay, I give you an example. You all saw the question. You all saw the picture just now on cadaveric lab anatomy. That experience can only be provided to students of certain schools, certain universities. Not every universities have that, especially big named universities like just know it's not every university have that lah. Okay, and we were fortunate enough to have that experience here in Taylor's.
Okay, this sounds cute. Rate your med school years out of 10.
Out of 10 I would say 10 lah, 10. But because of the stress, we go back to 1. Kidding. But I say it's been good so far. It's been good so far. My friends are good. My lectures are good. Studies have been great. I've been going out and learning a lot of things these days. I think it's 10 out of 10.
That's great to hear. Next question. What are your study tips? Example, like making notes or flashcards.
Study tips. Okay. This question is very interesting actually. It depends on who you are. Which level studies are you at now? So if you are a university student or in a medical school, I would say don't make notes. No more time for notes. You are just actively recall. All those Anki flashcards and all those active recall methods, use that. Okay, you don't have time anymore. But if you are in A levels, okay, what I did was I do all the past years. Okay.
Can Taylor's MBBS graduates work in overseas?
Sorry, I'm not. Yeah. Oh. So if you are in A level, when I was in A levels, what I did was I attempted all the past years, especially paper 3, paper 4, paper 5, all the essay questions, and I figure out what are all the common keywords that they usually grade them, would usually mark them. So I try to memorize all the keywords and then try to somehow fit them in my answers during exam. Okay. Yeah, that's for college A levels lah. If you want to pass. But and also what I did was especially mathematics and chemistry paper 1. I remember, very notorious, chemistry paper 1 and paper 3 and paper 4 mathematics. First I trained myself accuracy, then only I trained myself with speed. Okay. I always have a timer with me. I'm always that one nerd with that beeping timer. I always bring myself wherever I go and then train myself for speed. But accuracy first, then only speed.
Okay, moving on. Can Taylor's MBBS graduates work overseas?
Yes. See, the thing is, there's a misconception where if you graduate in Malaysia, you only can work in Malaysia. No, Okay, that's what I'm here today to just tell you all. It's not true. If you graduate here in Malaysia, especially, or if you are a graduate of tailors, it doesn't mean you cannot work anywhere else. There are pathways and there are exams you can sit for to qualify training in other countries. Okay, for example, if you are, like, let's say myself, if I want to work in the UK after graduation, after the minute I graduate, I will sit for an exam called PLAB, PLAB exam. Then my rankings will determine where I get posted in the UK for my training. So I can still work abroad despite being a graduate of Malaysia.
Okay, next question. What made you choose surgery?
I think it's just passion, passion and skills. Already answered just now, I think.
How do you stay passionate about medicine through the tough times? Because it's often that people drop out halfway.
Okay, I was just having this conversation with another junior the other day. See, burnouts are very, very common, especially in medicine, right? You go through your days, books, you have to study books, and then you have to stand on your feet for 3-4 hours and then come back. By the time you come back, it's already at night, no time to study. And even if you have to study, you got no energy and all. But there will be days to sort of remind you why you study medicine. And for me, in particular, it's all about surgery. So if the other day I got invited to do some surgery procedures, I take those as sort of my reminders why I need to push on and just continue with medicine. It's mini reminders throughout here and there in medicine you'll get. But also, I think my personal reason would be my family lah. Okay, because there's no doctors in my family, and I'm sort of the first to go through medical school. And if I am a doctor in the future, when I am a doctor in the future, I can treat my family. That's it.
Okay, next question. Why didn't you choose or UKM over Taylor's, as and UKM are recognized by Singapore Medical Council and MMC, which provide a wider chance in the future?
Okay, so this one, every time they will ask why and why Taylor's and not See, the thing is, one word answer lah, full scholarship. Full scholarship here in Taylor's, who doesn't want? Okay, in it's good. I understand it's good, but it's the way I see it, 150 students per cohort. It's something I don't think will be good for me. I want compared to a 30 students per cohort, I'd rather be put in the 30 students cohort so that I can get to know my lecturers and my friends, and plus it's a private uni. You know, the experience is very different. So I chose Taylor's over Some of you might think it's dumb of me, but I have those are my reasons lah.
Okay, for our very last question, any apps or websites that will help a med student?
Yes. Apps like 𝐌𝐞𝐝, again, your active recall is very important. I don't know what else. I don't use any other methods aside from 𝐌𝐞𝐝. And also online, again, your study method, even in A-levels or whatever course you are in now, especially in medicine, you don't only learn from patients and textbooks. There are a lot of resource materials out there, good ones, especially YouTube. There are a lot of YouTube videos out there from very, very good YouTubers, doctors themselves. They are content creators. It's very good for exams when you just need to revise on certain things, and you can even speed through those videos, so you don't have to, listen to the whole video and waste time. So I like also YouTube, but you need to know which YouTuber to watch out. You need to watch out for lah. And also on my free times, I listen to podcasts, medical podcasts on Spotify. So try to be resourceful and don't just stick to textbooks and paper materials and, yeah.
Next question. But does overseas branch medical school in Malaysia graduates are exempted from entrance exams who wants to work overseas?
Is overseas branch medical school in Malaysia graduate exempted from? Okay. Okay, I think in order for me to answer this, I think this person was referring to, let's say, RUMC, the RCSI UCD Medical College, previously known as Penang Medical College, where the first 2 years they will have to go do their studies in Ireland. Then in clinical years, year 3 onwards, they come here to Malaysia to work. And then after they graduate, whether they get exempted from entrance exams or not, that is dependent on the university themselves and the contract. Okay. I'm not sure about Ireland pathways, but I do know there's this university called Perdana and RCSI, Perdana and RCSI University, where once they graduate and they are conferred the degree, they can work there. Okay, and also Monash University. Once you are a graduate of Monash University, if you don't want to work here, you can work in Australia. There are a few schools who provide this sort of method. Newcastle also, but again, it's very expensive. And if money is no matter to you nor your parents, then I say go for it lah. Okay, but again, don't go anywhere else lah. Come back here, Malaysia. We all need you. I need you. Okay.
All right. What are some of the YouTube channels that you recommend?
I recommend, okay, Osmosis is very good. I love Osmosis. The pictures make sense to me. I'm a visual learner. I like pictures a lot. Osmosis pictures are very good, and also Ninja Nerd Academy or something like that. Others all, there are a few good independent YouTubers you can look out for lah. But those a bit something about the independent ones are sometimes their contents are not right. Okay, and another hint would be to, when you find a good video, you always go to the comment section below, see whether there's any negative comments or not. If there's a lot of negative comments, you might as well just stay away from the video altogether. Okay, so again, Osmosis, that's my number one.
Next question. I will be finishing foundation in next year, February. Is it better to start MBBS in March or September?
Okay. I think this is sort of a personal question. Okay, if you are, okay, before this whole webinar started, I asked the TLPMC people, are they want to start, are they taking a year break or not? And they say they don't want, because they want to immediately start. So the earlier you start, the earlier you graduate, also good. But if you want to take a year break, what is it, a gap year or gap years, to, you know, find yourself and to sort of become more mature, also good. It doesn't matter to me, to be honest. But if, like me personally, I took a 1 year gap. I just enjoyed myself, played a lot before starting medical school. So I don't regret my decision lah. Okay, so if you choose March or September, I think it won't matter lah, because eventually you become a doctor also. Okay.
Okay, the next question. Compare A-levels with MBBS.
Is there a question? Oh, compare the syllabus.
Yes.
Compare the syllabus. Okay. See, there's when I first started out also, I also thought to myself, okay, because I'm a graduate of A-levels, I would have the upper hand in MBBS because the syllabus is much more in depth, and it prepares me to be very I was a very studious person and it prepared me to be even more studious. Okay, and I used to think that, okay, it trained me for my MBBS program, but actually no, it doesn't. It doesn't matter which course you are in, whether you're from foundation, whether you're from SACE, you're at STPM, or even A-levels, because MBBS is a whole new league. Okay, nothing can help you prepare for MBBS. Entrance, yes, you can prepare yourself for entrance into MBBS, but syllabus wise, you just have to experience it. But this you can't prepare yourself syllabus wise.
Okay, if that's all the questions we have, thank you so much, Robert, for your amazing answers.
No worries, no worries. My pleasure. Thanks, guys.
It seems like that's all the time we have for today. So any unanswered questions will be posted on TLPMC's Instagram page. Those of you who still have some questions left can stay back and hang out with us for a little while longer.
Okay, do help us out by filling out the feedback form, which is now probably getting sent in a chat box, or scan the QR code that will be displayed and let us know what we can do to improve and ideas for future events. Feel free to follow our Instagram page as well for later future updates. We hope that this event has helped you gain more insights into medical school and hopefully build that confidence and motivation you need to attain this dream.
Thank you all so much for coming. We hope you enjoyed this event and learned a lot about the pathway into med school. Thank you so much to Mr. Robert as well for your participation. Those of you who have any further queries, you may stay back. The rest may leave now. Thank you for your time.
Thank you guys. Hope you
Thank you.
enjoyed.